Hi, I'm Jacqui Mooney, the editor of Prevention Magazine, and I'm thrilled to be here today with Julianne Mitchell, Health Director at the Heart Foundation, and we're thrilled to have the Heart Foundation as one of our sponsors for National Prevention Week 2016. So thank you so much for being here, Julianne.
Thank you.
Now, heart disease is such an important issue. It is actually the biggest killer in Australia, and I think many people would be surprised to know that it actually claims 3 times as many lives as breast cancer. Often it's thought about as very much a male disease, and nothing could be further from the truth. So what do you think is the key to raising awareness around heart health for women?
Look, I think it is dispelling the myth that heart disease is a man's disease. Heart disease is the leading cause of death in Australian women. We really have a job on our hands to encourage women to be as vigilant about their own heart health as they are about their male partners, brothers, sons, and family members.
And what do you think are some of the particular issues around heart disease for younger women?
Look, I think that there is an assumption that heart disease only affects older people, but in fact, heart disease does not discriminate. It can occur at any time in a person's life. And particularly for younger women, our risk factors start laying down in our 20s. So those nights that we're out binge drinking, eating fast food, living on adrenaline, they do start to have an effect and really do influence our longer term health. So there's some of the issues. Certainly there are issues for young women who may smoke and also take contraception. That increases the risk of heart and blood problems. And we know that for a small percentage of pregnant women, heart disease complications can occur. It's only in a small part of the population, but it's certainly something to be mindful of.
Yes, it's such an important thing that I think many women aren't aware of.
No, that's right. And we've got to really spread this message as much as we can. In our surveys, we know that only 3 to 4 out of 10 women think of heart disease as personally relevant. Far too many focus on other issues, and we need to be more holistic in the way in which we approach heart health.
And what about family history? Is that a factor?
Yes, it is actually. We really need to know what our family history is, what our mother, father, grandparents were affected by, because if they've died of heart disease or had heart disease complications, then it does increase the risk or likelihood that you too may be at risk.
And the symptoms of a heart attack, they can be quite different to what you see in the movies, and also they can be quite different for women than they are for men. So could you talk a little bit about those differences and the signs that women should look out for?
Sure. Heart attacks are not always what you think. We know that in 40% of cases, women will not experience that clutching chest pain. They are more likely to experience non-chest pain symptoms like jaw pain, arm pain, or just a general sense of fatigue or nausea. Women really need to be alert to these symptoms because too many of us put it off, attribute it to gardening or to just feeling run down, when in fact it may be a real warning sign that you need to get to hospital, and you need to get to hospital fast.
So if in doubt, get it checked out.
Absolutely.
And what about the lifestyle changes that we can all make, the really simple ones that can make a difference? What would you suggest?
Look, it's the everyday choices that we make in our lives that will make the biggest change. So the decisions that we make to walk or ride to work rather than drive to work, the amount of time that we sit down, whether it's in front of a computer, a TV screen or a movie screen, we really need to look at trying to put more activity into our day. So that's the first thing. We need to think about the food we eat, and it's not always that you have to deny yourself. It's more swap it, don't stop it. So go for a low-fat skim flat white rather than a megachino, choosing fruit occasionally instead of dessert. Those things really do make a difference in our overall health.
And plenty of heart-healthy foods like avocado and salmon, I would imagine.
Absolutely. I mean, whole foods, fruits, vegetables, lean meats, these are the things that we should be choosing when we're putting together our dinner menu or our lunchtime lunchbox to take to work. These things matter.
And what are some of the exciting innovations in the health space that you in particular are excited about?
I'm really excited about the use of new technologies and particularly the mobile phone. We all carry it with us. It's our best friend in some respects. So we are now, scientists are now using that technology to send reminders to men and women about how you can be heart healthy, to take your tablets as directed, to really hear those messages. And we're also developing apps that really encourage you to make those healthy choices through the day. So I think stay tuned for the ability of mobile phones to really closely monitor our heart health.
And lastly, if there was one message you'd like to leave Australian women with about their heart health, what would that be?
Look, I think the number one is to know your numbers. Know the number of your doctor to make a heart health check appointment. Know your blood pressure and your cholesterol levels, and know to call 000 if you think you're having a heart attack. No one's ever died of embarrassment because it turned out to be indigestion or a pulled muscle rather than a heart attack. But it's better to be safe than sorry.
Well, that is fantastic advice. It's been a pleasure speaking with you today, Julianne. Thank you so much to you and the Heart Foundation for being involved in National Prevention Week. It's been a pleasure.
Thank you, Jacqui, and to the Prevention magazine.